Navigating the healthcare system can feel overwhelming, but thanks to a new national movement called Worthy, that may soon change. Here to discuss how this movement aims to deliver meaningful healthcare reform for all is President and CEO of Ascendiun, Paul Markovich. Paul, good morning.
Good morning, Jessica. Thanks for having me.
Of course. So why does healthcare still feel so expensive for everyday families?
Well, it feels expensive because it is expensive. The average family health insurance premium is now $27,000 a year, and that keeps rising at a rate faster than most of the other things that we have to purchase. And the biggest reason for that is that all the participants in the system tend to get paid to do more, and therefore we get more. A good example of this is colonoscopies for colon cancer screening. You know, in most Western European countries, the vast majority of people just do a simple, inexpensive at-home test for their colon cancer screening. But in the United States, the vast majority of the people have to take a day off work, get an anesthetic, go through an invasive colonoscopy procedure, all for that same screen. And it's not because it's better or more convenient for the patient, it's because the folks doing it charge thousands of dollars for the colonoscopy as opposed to tens of dollars for an at-home test.
Yeah, and expanding on that just a bit, what's really behind the rising costs Americans are seeing, even at the pharmacy?
Yeah, well, pharmacy is interesting because there's all these intermediaries between the company that produces the drug and the patient that takes the drug, and they all effectively get a commission on the price of the drug. So their incentive is to sell and administer a higher volume of more expensive drugs. And so that is exactly what happens. And one of the things that Worthy is advocating for is to change that system because it's just crushing the wallets of Americans.
So what is it that is making this new movement behind Worthy really different from past efforts, perhaps?
Well, Worthy's trying to get to the root cause of what is making healthcare so expensive, impersonal, and inconvenient. And a great example of this is Worthy is advocating to pass a federal law to create a comprehensive real-time digital health record for every American, which can both help personalize their care, but also take a lot of administrative hassle and cost out of the system. For anyone who's had to go to an office and use a clipboard or get a fax or ask to be faxed information, you know what I'm talking about. Healthcare is using a lot of antiquated technology to do things that can be done a lot easier and simpler than they are, but it requires us to effectively drag the industry into the digital age.
Well, the resolution may be a bit layered, but what changes could realistically lower out-of-pocket costs and rebuild trust in the system?
Well, I think trust happens when you have knowledge and the confidence that the people around you have your back. And the knowledge can happen when we create that comprehensive digital health record and all that information is available to you and your treating clinicians. And it also happens when the people who are treating you, you know, are getting paid to help you get healthier and happier with your service. When that's the case, you can be confident that the decisions they're making are in your best interest. And when all of those things happen, when you rebuild the trust in that way, you make healthcare more affordable.
Well, Paul, for viewers watching right now, where can they go to learn more or even get involved in the Worthy movement?
Thisisworthy.com is our website, and there you can see what we think is wrong with the healthcare system, the reforms we think that need to happen to change it, and you can sign a pledge and get engaged.
Well, thank you so much for your insight this morning.
It's been my pleasure. Thanks for having me.
For more information, just visit thisisworthy.com.